Yeah. The healthcare professional presentation. Um, my name is Devonna Williamson. I'm a talent business partner at Freighted, and I will be your host. Today's presentation is sponsored by Advocate Aurora, Ascension, Children's Wisconsin, and Freighted Health. A few housekeeping items. We are recommending that if you have a mobile phone, we are going to have an activity towards the end of the presentation at www.kahoot.it, and that's Kahoot, Kahoot.it. Please feel free to head in that direction at this time so that you're ready to go at the time of the activity. And again, that is www.KAH0OOTIT. Again, KAHOOT.it. If you do have any questions as we're going along in the presentation, please feel free to type them into the chat, and we will ask them of our speaker as we, get the opportunity. But we look forward to hearing your questions and hope that you, enjoy the rest of the presentation. Today's topic is medical office administration. We're lucky enough to have Christy Jobs here with us. She is the operations office assistant that will be representing the medical office administration role for us. And Christy is from Ascension. Christy, welcome, and tell us a little bit about you.
Thank you. I have been working for Ascension for 6 years. I started out at a different clinic, transferred over to the one that I'm currently at. I do help out at other clinics when somebody is either on vacation or somebody called in sick and they actually need extra help. I will go to those clinics also.
Great. Well, when you say operations office assistant or medical office assistant, what do you do on a day-to-day, what's your schedule like? What sort of things do you do?
When we come in, obviously, we check the fax machines for all the faxes that came in throughout the night. We get ourselves all logged into the computer and ready to greet the patients when they come through the doors.
Okay, well, is there a reason why you have opted to go in this direction in this field? I know you said you've been doing it for 6 years. What drew you towards being a medical office assistant?
I actually went to college and I have a degree for administrative assistant. And this basically is pretty much what you are. You're an administrative assistant. You do all kinds of things for doctors, for medical assistants. You help out the patients. So you're constantly busy. And that's what I enjoy about this position.
So you went to school. Is that what kind of degree do you have? I know.
I have a associate's degree
Okay.
for
So
administrative assistant.
is that something that's required for this field to go into?
Not necessarily, no.
Okay.
Um, as long as you've got your typing skills, you have communication skills, you are detail oriented, you're friendly, you're basically a people person. This is a
Okay.
really good job for it.
So someone could have a high school diploma or a GED, something along those
Correct.
lines and
Yeah.
head into this field. And
Yep.
I know you were just listing off a couple of skills and you said people oriented, uh,
Yes.
and then
Friendly.
a requirement.
Yeah.
Okay. And then you said computer skills.
Yes. Computer skills, communication skills. Um, got to be a team player, because if you're not a team player, this just wouldn't work out.
What sort of computer programs do you use? I mean, do I need to be an Excel wizard? Do I?
They used to have, Microsoft Excel and Microsoft Word, but they have now changed it to Google.
Okay.
And I have never been in those software programs, but they are so easy to go through that I picked it up pretty easily.
Okay, great. Wonderful. So you've learned as you've been in your role,
Correct. Correct.
constantly learning. Um, so are there any suggestions that you would give to um, a high school student or even someone who is going off to college, who's maybe thinking about a career in the medical office arena?
Oh, yeah. Um, I actually enjoy it. I like getting to know the patients. You form a bond with some of these patients. And I don't, to me, I've always enjoyed working in an office. So this is a perfect way to start out. And eventually you could move to other departments, or you could become a medical assistant or even become a nurse. But this is a good opportunity, perfect position to start out at.
So you brought up a medical assistant, and this presentation has been titled Medical Office Administration. What is the difference between what a medical assistant does and what you do?
Basically, a medical assistant will bring the patient into a room and they'll take their vitals, they'll, get their medical history, and they basically get them all prepped to see the doctor. What we do is we get all their demographics, we get their insurance information, we make sure their address and phone number is correct, and then we get them ready for the medical assistants.
So both of you are interacting and dealing with
Right.
the patient or maybe their family members,
Right.
but the medical assistant touches the patient.
Right. Exactly. They take their blood pressure, they take their
Temperature.
temperature and all their vitals, and they get them ready for the doctor, but we get them ready for the medical assistants.
Okay, great. So both of you have to be able to interact with the customer, the patient. One touches, the other one doesn't touch.
Correct. Correct.
Side of it. I'm definitely one of those people who love to help people, but I could never do what a nurse or an MA does. I don't want to have to touch people. So knowing that
I'm
there
the
are,
same way.
yeah, that there are roles out there like yours that allow you to help
Right.
without having to touch.
Right. Right. Exactly.
So what do you enjoy most about your job?
Um, I enjoy getting to know the patients. They have really great stories to tell you, regarding their lives or family members or, just things that they've done. Sometimes you'll get the gentlemen who've been in the military
Mhm.
and they'll tell you stories, and it's fascinating.
Mhm.
I absolutely love it.
Well, getting to interact with people, getting to know a little bit about them is, probably a great reason to be in healthcare and wanting to help them.
Correct.
And it's great that you get to do that through their job. But I think any job, even if we really like it, there's an aspect of it that maybe we don't enjoy as much. What would you say you like least about your job?
The pandemic for sure.
Okay. Oh,
that has put a lot of challenges into the workforce. And then you get patients, and I'll be honest, you get patients that are having a bad day and you're the first to interact with that. And you have to realize it's not me that they're mad at or they're frustrated with. It's they're having a bad day and you're the one that they're taking it out on. So you do
no.
kind of have to be thick-skinned to be able to work here.
Okay, right. So patients coming in typically because they're not feeling well.
Right, right.
And you're the person who is, like you
And when
said, the
you're
first person.
asking, yeah, and when you're asking a bunch of questions, what is your birthday? What is your address? What is your phone? They'll get frustrated with you. And it's
Mhm.
like, I'm sorry, you just have to explain, I'm sorry, I'm just doing my job. This is required. I'll try to get through this as quickly as I can for you.
And can I touch briefly on something that you brought up? You brought up the pandemic and how it's, made things more challenging. Can you just kind of explain how that's maybe affected your role a little bit?
Yeah. When the pandemic first came around, the clinic I worked at, we were not taking in sick patients.
Mm.
We were taking in the what you call healthy patients.
Mm-hmm.
So it was challenging because, these patients are not feeling well, want to see the doctor, and we had to tell them that they had to go somewhere else. And that, you hate telling patients that.
Mm-hmm. So really based upon if they were showing signs or symptoms or conceivably could have had signs and symptoms of COVID, you guys weren't able
Correct.
to see them. And I think we all
Correct.
made, had to answer those questions. Any signs and symptoms of, and then if they
Right.
did have the signs and symptoms, sorry, you can't come in this way. You can't.
Right. Even if
Okay.
the patient said, well, all I have is a sinus infection.
Right.
We get that. We really get that. But at the time, we couldn't see anybody. So,
No, yeah. So it's very interesting hearing that. You're probably the first person I've spoken to through any of these presentations who has brought up how, the pandemic has, affected them as the job. So thank you for sharing that. I think that's important for people to hear.
right.
You talked about the medical assistant, and you as a medical office, administration and assistant, but who do you work alongside besides the MAs, the medical assistants? Like, who else do you interact with in your job?
Sometimes we'll interact with the nurses because we do take calls for the nurses and we take the information down and we send the message to the nurse. But we also have to determine if this is an emergency.
Mm,
Do we send the message or do we just automatically put that patient in to the phone call with the nurse? So it's kind of like you have to have, you don't really necessarily have to have a medical background, but it helps.
great.
And, like I said, we work along with the nurses, we work along with the doctors. If the doctors need anything and they can't find their medical assistant because their medical assistant might be in another room with another patient, they'll come up and ask us, can you do this for me? Or can you do this for me? And yeah, you really, that's why I say you have to be a team player.
Great.
You can't get frustrated too easily.
So you had mentioned before this possibly being a stepping stone, or a great way to get into the medical field. So you do get the opportunity to interact with the medical assistants, the nurses, and also it sounds like some interaction with physicians. So if you do have
Right.
a desire to move into a role that allows you to touch
Right.
patients, um, you have that opportunity. Okay, great. We did get a chat question here, which was just asking what sort of classes should maybe a student take in high school that would help make them job ready? Would a psychology class help? What would be helpful?
Psychology would help. It kind of helps you interact with the patients, because they honestly will tell you all their injuries, all their sicknesses, what is going on with their families. And yeah, psychology is the really good class to take.
Okay,
because
great.
it does help you be able to understand where that patient is coming from.
Great.
And as far as classes in high school, take, computer classes, typing classes, whatever. I took shorthand, which I'm sure they don't offer that anymore in high school, but I took shorthand classes, I took computer classes,
Great. I
even
think
science too. That'll help out too.
yeah, so I was going to say, I think you had mentioned a little bit earlier about maybe having a medical background might be helpful. Does it make
Right.
sense to take biology class or a medical terminology class or something like that?
Yeah. Yeah, it completely makes sense because especially when the patients are calling and they say, I need a refill on such and such medication, you should be able to know how to spell that medication and kind of know what that medication is for, because sometimes they'll call and say, well, I don't know what the name is, but it's for my diabetes or it's for my blood pressure or, and you got to know, okay, when I look on their medical chart, which medications are for what.
Okay.
So it does help. Yeah.
Okay, great. Wonderful. Yes. And as we all know, medical terminology, big words.
Yes. And a lot
Okay.
of these prescriptions are going, I'm not quite sure how to even pronounce that, but
Right.
okay.
Exactly. It has how many syllables? Um,
Right.
so I don't know that we've addressed this, but what sort of setting is a medical office assistant typically in? Where are you in the building? What kind of buildings are you working in? Is it hospitals or?
You can work in hospitals, you can work in dental clinics, you can work in medical clinics, pretty much, yeah, pretty much anywhere.
Okay, great, wonderful. Um, are you, as a medical office assistant, are you on your feet running around a lot? Is it, behind a desk? Is it?
You are basically in your chair
Okay,
from the time you come in to the time you leave. You might get up every once in a while to send a fax out that a medical assistant or a doctor wants you to send a fax. You get a little bit of a break. You do get your lunch break. But other than that, you're in your chair because you're constantly having patients coming in and you're constantly, the phone will keep ringing. And so you forget that you haven't stood up for a while.
until you stand up and then you're like,
Right.
oh,
Until you stand up and your legs are like, give me a second to,
catch up with you here.
yeah.
So I just want to make certain that I remind people if you do have other questions to please put them in the chat. But I also wanted to just clarify something that we touched on a little bit, but just to kind of um, I guess focus in because lots of different healthcare systems, lots of different opportunities that exist. Your official title is Operations Office Administrator.
Correct.
Okay. And as I said, this presentation is medical office, administrator. That's the focus of it. We're talking about the same thing. Are you aware of any other job titles that kind of cover some of the activities that you would do that other people might see?
I mean, you have your insurance people,
Okay.
you have your coding, because we'll have patients that will call and say, my billing is wrong because of the coding.
Okay.
So you've got the coding department that, you have to send them to, or we'll sit there and say, okay, well, we'll send a message to them. They'll get a hold of you. So yeah, you're working pretty much with everybody, but you
And
have different places you can move to. So you
okay.
can move to the billing department, you can move to the coding department, medical records department. We send stuff to them all the time that, one patient is coming from Aurora or Freighter and we need their medical records. So yeah.
So you brought up insurance and billing, and obviously you just gave an example of like a patient saying, "Hey, my bill looks wrong," and they're calling the clinic.
Right.
But in what ways are you talking to the patients about insurance? Is that
There's times that we like to, before they come into the office, to make sure that they are covered under that insurance. We will call them and ask them, what insurance do you have? What is your group number on there? What's your policy number on there? on the back of the card, does it show what address we're supposed to send the claims to? And if you don't pick the correct insurance package, that screws up billing for them. And it's just a whole nother steps. So you really got to be cautious and careful as to what insurance packages you're picking.
So you are doing phones, like
Yes,
taking in calls. You are greeting people when they come in and chatting with
correct,
them about their needs, interacting with the doctors, nurses, the MAs, in the clinic areas that you're in. Um,
correct.
and then you also have to make outgoing calls, as you're indicating,
Yes,
to maybe other clinics or other hospital systems even, and that sort of a thing. So
right,
touching a lot of different areas
right.
in
And
your
when
area.
we take the phone calls, we schedule the appointments over the phone, because we'll have patients that will call and say, my shoulder hurts, or, whatever. And then we have to make those appointments for the patients on the phone. Or sometimes you get a patient that just walks right in and they say, well, I would like to see the doctor. So then, you got to go through all that. And if they've never been seen within Ascension or any, freighter or Aurora, you have to gather as much information as you can. And that takes a little time.
Well, that's great.
But
That's
yeah,
wonderful.
the day is constantly busy.
So yeah, and I know that sometimes that's what people think about is, am I going to be on my feet because I want to stay busy, forgetting that there's a lot that happens sometimes when you're not on your feet that keeps you constantly doing
Right,
things. So, okay, great.
right.
Wonderful. I do think that we are ready to move to our quiz, our activity. As I had mentioned earlier, you want to go to www.kahoot. Um, Okay. I am being informed that we did have some tech issues, and so we will probably need to actually skip the quiz. So I apologize that we won't be able to go through that with you. Hopefully, we'll be able to get that up and running for some future presentations. Technology is, you know, not always our best friend.
Lovely.
Um, so I am going to go on to a couple other questions that I have, of course, and I am going to ask other people that if you have any questions to enter them into the chat so that we can respond to those. You touched on this briefly, Christy, but I'm just going to ask a little bit about it again. So you said growth opportunities or career, changes. You mentioned
Mhm.
maybe going into coding, maybe going into billing. Are there any
Correct.
other careers that sometimes people will go into after starting off as a medical office administrative?
As a matter of fact, I have a coworker that is actually taking classes now to be a medical assistant.
Okay, great. So now he or she wants to go and touch the patients
Correct.
again. All
Yeah,
right.
yeah. There's lots of growth. I mean, eventually you could become a supervisor of your department. You could become a manager of your clinic. You know, there's
Okay.
so much growth that,
Okay.
yeah,
So you can get into leadership through this
correct,
role. Okay,
correct.
great,
Yeah,
wonderful. So, you said that you'd got an associate's degree, so you went to school for 2 years. We did
I
mention that
did.
not everybody has to do that. Do you find that your peers or the people that you're working alongside who have similar titles from you are coming directly into your role out of high school, or are they typically doing some sort of role beforehand?
No, I've actually seen some come right directly from high school. They come from college. And I actually enjoy it because they seem to know a little bit more than what we've learned. So they're coming in and they're actually teaching us some things to where we can turn around and say, okay, well, this is how you do things, in this clinic. So it's kind of like we're both teaching each other new things. So it's always nice to get high school kids and college kids coming in, and because they grew up with technology and a lot of us didn't.
Right, right. So they're
So they can
teaching you.
show us some things that we were like, oh, are you kidding me? I didn't know that.
Some of the Google stuff that you were referring to.
Yeah, some of the Google stuff. Yeah. And
Oh,
some, they learn Epic before we do. And so it's kind of nice that they can give us different ways of doing things.
so I thank you for bringing that up. I was actually going to try and uh, ask a question about that. Can you tell people what Epic is in general?
A very challenging software program.
Um,
But no, it is, once you get to learn Epic, it's very nice. It's very touchy, but there's a lot of different things to learn in Epic and different ways of doing things. And Epic requires more information from patients, like a couple of the questions that they ask is, what is your religion? And have you served in the military? And if you have, what branch? And we've never had to ask those questions before. So Epic is bringing more demographic information in on the patient than our previous software programs.
so a question that came in, and I don't know if you know it, but I kind of know it. The answer to the question, a question that came in is like, do all of the hospitals use Epic? In this
Yes.
local area, yeah, in
Yeah.
Wisconsin, or at least southeastern Wisconsin, um, Ascension, Freighter, Aurora,
Aurora.
Children's use Epic.
Yep.
It is they're headquartered actually in Madison, Wisconsin,
And
but
if you
it
ever want to go to Madison, they have the most beautiful facility. And
yeah,
I mean,
that
look it up on Google.
yep. Okay, so Google is known for having a beautiful campus. Like the Google headquarters are supposed to be great and wonderful. Epic also has an amazing headquarters and
They
is kind of
do.
recognized for all the things that they have on their Epic campus. Epic is the electronic medical record or electronic health record that all of these hospital systems utilize
Right.
to enter in information, collect information regarding our patients,
Yeah, they collect a lot more information than what our previous
systems did.
program collected.
Yeah. And as Christy was saying, not all healthcare systems use it exactly the same way. So the way that she uses it at her clinic is going to be slightly different than how Freighter uses it at their clinic, which is slightly different than how
Right.
Children's uses it at their clinic. But it is something that if you've used it at one site, you have the basics and you could come to another site and to another campus or another hospital
Right.
system and utilize it.
Well, and it's
Um,
nice too, because the doctors, if they say, oh, I went to Aurora emergency department, here at Ascension, the doctors can actually go off of Epic and grab their information from the emergency department through Aurora or through Freighter or, yeah.
because
So
all
that's
of the
kind of nice
systems are
too.
talking to each other
Right,
in a
right,
way which saves time. That patient, you're not waiting for something to be sent to you. You can actually go in and grab what you need immediately for that patient versus the delay of like reaching out to another system to get the information sent. So
right, right.
it is a challenging system, but we're also Epic fans because of how
Exactly.
much it's used in this area. A question did come in saying, can you take an Epic class without working for a hospital? My understanding is no. You actually have to be part of a healthcare system in order for Epic to actually let you use their system. I suppose you
Right.
could go to school for computers and apply to work at Epic and then start using Epic that way. But
You
but
could.
realistically, if you're thinking, hey, how do I get this software or this technology underneath my belt so that I can step into healthcare, you have to actually start in healthcare and learn it in healthcare.
Right, right.
And then there was
And
another, go
just
ahead.
to note too, we actually, you can actually get a job working for Ascension, but also working for Epic.
Hmm.
Because we've had a couple medical assistants that have gone from being a medical assistant to working with Epic. And they'll go around and they'll train other facilities, hospital staff, medical staff. So yeah, there's so much that you can do in the medical field.
And it sounds like being in the medical office, admin kind of a role is a role that really does just kind of give you opportunities touch people, to not touch people, to work with computers, to
Right.
work with billing,
Right.
it's a looks like it's a really great opportunity. We did have one other question here that had come through, and we may have touched on this, but I'm going to ask it just to make certain
Sure.
that we get it. What would be a good job to have in high school that will help prepare me for this type of career?
Oh, working in a office facility
Okay.
doesn't necessarily have to be medical, but working, because I did that, I worked at a bank. Through high school, I worked um, at a corporate office doing office settings, and that actually helped with the job here. So anything in an office facility,
Great.
whether it's a bank or insurance company, as long as you're working in the office and you're doing office, I don't know how you want to say, clerical work,
Activities. Yeah.
whatever.
Hmm.
Yeah, yeah, that will actually help.
Okay, great. Wonderful. Um, so that I believe was the last question. I don't see any more coming in. I don't have any further questions for you. Christy, is there anything else that you would like to share with, those who may be watching our presentation about medical office administration?
If you like working in an office and you like dealing with people, this is an awesome job to do it.
Great. Wonderful. Well, Christy, we really appreciate you chatting with us and presenting today on the topic of medical office assistant, which I don't think that people always think of as part of what helps make a hospital or a clinic or doctors and nurses run better, but
Right.
it is.
Well, and two, I have a daughter who's in high school
Mhm.
and she's a sophomore. And when I come home and I talk about my day, she's amazed as to how much stuff I have to go through and what I do all day long. And she's like, I don't know how you do it.
Mhm.
She goes, it's awesome. She goes, but I don't know how you do it.
And that's what I think is such a value for people, is to realize just how important every role is, and that you in your role can help so many different people, and people, that this is an important activity and job, and it's great that we are
Right.
able to get people exposed to that today.
Yeah.
Um, if anyone does have any questions regarding being a medical office administrator, operations office administrator, anything along those lines, more of the clerical settings in our clinics and our hospitals, definitely reach out to Joan Ward for any questions. It is joan.ward@employmilwaukee.org. Again, joan.ward@employmilwaukee.org. And Joan will either direct you towards Christy, who can help maybe answer some questions,
Sure.
or get the answers from Christy to get to you. Or, of course, if Joan knows the answers already, she will, answer those for you as well. Again, we appreciate everyone taking time to join us today, and we hope that your week is off to a wonderful start. Thank you again, Christy.
You're welcome. Thank you.
Thanks.